Good morning. I'm very pleased to be here, and I'm very pleased to see a sizable group, see some familiar faces, some new faces, so this is good. This information needs exposure, and it's groups like this that are the irritants that grow to the pearl. Now, I want to talk about something that Dr. Honeyhackey and I have put together and utilizing at the Riordan Clinic called the Ascorbazone Protocol for ascorbate and ozone, taking off on some of the other things that ozone has been related with, like prolozone, procaine, and ozone. And this is anywhere you see a reference with a number, you can go straight to PubMed and pull the reference, whether it's the abstract or the whole article. Now, the basic concept of ascorbazone is that you want to combine vitamin C, which in high doses will have a pro-oxidant effect in cancer and infectious pathogens, etc., and ozone. And when you use the two together, it appears that there's a synergistic effect, not just an additive effect, but a synergistic effect. 1 + 1 ends up equaling 3 rather than, or even 4 or 5 rather than 2. Also, as we're going to see, not just in this presentation, but I think throughout these 3 days, is that the vast majority, and by vast majority I mean greater than 90% for sure, of all chronic degenerative diseases are fed by the oxidative stress related to focal infections. And those focal infections, greater than 90% of the time, are in the oral cavities. Okay, infected teeth, tonsils, gums, etc. The other thing is with this protocol, we're going to see that it's not going to be not only good for infections, but it's going to be good for any chronic degenerative disease because of what I just said, which is virtually all the chronic degenerative diseases are being fed by occult infections. So even when you can't identify the infection, you can either eradicate it or hopefully at least keep it at bay and be giving it something that can neutralize the new regenerated oxidative stress on a daily basis. So the concepts of ascorbazone are these. You want to achieve vitamin C saturation, okay? Almost everything that vitamin C is unable to impact significantly clinically is because you don't get a high enough concentration where you want it to be. So the goal of this protocol is, number one, get vitamin C saturation and get the amounts of ascorbate in the tissues, inside the cells, in the extracellular fluid, in the plasma, to as high a level as possible and sustain it as best as possible. Number two, ozone. As much as I love vitamin C, I got to tell you, straight up, ozone is going to nuke an infection even better than vitamin C. Okay, but why not use both? And so that's the point here. And this one is important as well. We're going to have some other presentations talking about hormones and various applications, etc. And I want to tell you at the outset that how effective vitamin C and ozone and any other anti-infectious therapy that you use is going to be is profoundly related to normal hormone status. I mean, a root canal is strongly associated with causing a heart attack, but amazingly enough, a heart attack will rarely occur when you have a root canal if you have an absolutely normal thyroid status. So just being minimally hypothyroid can profoundly facilitate the ability of focal infections, in this case, oral pathogens inside the coronary artery of taking hold and developing atherosclerosis. And it's also true with testosterone in men and estrogen in the women. And as Dr. McCarthy will be pointing out, other important vitamins, in this case maintaining normal levels of vitamin D, is enormously important in facilitating the best effects of vitamin C on an infection or anything else. Now, what does vitamin C do by itself and has been documented to do? Number one, the ultimate antidote. It will neutralize all toxins. I know of no exceptions, and I've been looking for them for over 10 years now. And it also allows to reverse the toxic impact, AKA oxidation. The way that toxins poison is by oxidizing. That's it. That's the only way a toxin is toxic, is by oxidizing biomolecules. That's it, okay? And if you're able to undo that oxidative effect and reduce it, you completely eliminate the toxicity. Unfortunately, it's not always that easy, but at least theoretically, that's what you aim for. Vitamin C helps normalize the redox balance. As I just said, it helps repair tissues. And here, and I outlined this in a couple of my books with all the references, in at least 20 different separate mechanisms, at least 20, vitamin C directly strengthens and supports the immune system. So even when vitamin C is not, for example, able to directly attack a pathogen, by virtue of what it does to the immune system, you can still get a profound impact from the vitamin C, especially over a prolonged treatment period. Vitamin C is the ultimate antiviral agent and extremely effective against other pathogens. Vitamin C, by virtue of its interactions with glutathione, directly promotes the excretion and chelation of intercellular toxins and their toxic byproducts. And finally, all diseases utilize and use up vitamin C. So every infection, every chronic disease induces some degree of scurvy. So even when the vitamin C is not necessarily directly attacking the pathogen, it's still helping to restore that part of the body back to normal, which will give you much more support in treating what you're trying to treat. Now, what has ozone been documented to do by itself? Kill viruses, bacteria, fungi, destroying cell membranes. And like I said, I love vitamin C, but I gotta be honest, ozone does a better job of it than vitamin C. Another thing that ozone does that not many things do very well is they dissolve and disrupt biofilms. I call them pathogen condominiums, okay? You want to get to the occupants, but you got rebar condominiums surrounding the occupants, and just because what you have will kill the occupants doesn't kill them if you can't get it to them. So you need something to tear down the protective edifice that is keeping your therapeutic substances from getting to your targets. Now, what ozone does is magic. I call ozone the magic molecule because even though I'm going to point out a few suggested mechanisms here, and I've talked to ozone experts about this, and they smile and they agree with me, is the best way to understand ozone when you put it in the body is it does everything you want it to do, and it doesn't do anything of what you don't want it to do. Some of the suggested mechanisms for that are it's very reactive, and it doesn't last in the blood long. It immediately forms what's called ozonides. And by mechanisms unclear, it oxidizes, an oxidant effect on pathogens. And one suggestion is pathogens have very little antioxidant capacity in their membranes. whereas normal cells do have a lot of antioxidants. So this is one theory as to why ozone goes in and readily destroys all the pathogens and all the nasty cells and leaves the normal cells alone. But I go back to the best way to understand ozone is its magic on your side. Now, ozone in the oral cavity. Many diseases, like I said, I consider it to be well over 90%, get their foothold from oral cavity infections. And one of the reasons is the nasopharyngeal mucosa just colonizes pathogens like crazy, even when you don't have a full-blown infectious disease. So one way I would suggest to maintain health is, when available, to do what's called nasal insufflation with ozone, because it can periodically, just like you use vitamin C powder to do a C flush and reboot the gut, you can use ozone insufflation to reboot a pathogen colonizing nasopharyngeal mucosa. It's important, though, that it gets bubbled through olive oil. You don't do that, you're going to react very quickly, because one thing that ozone is highly toxic for inside the normal human being is the bronchial airways, okay? And just as a little side point, this is one of the best ways I know of to actually eradicate an early cold. Doing 30 minutes of nasal insufflation knocks out the pathogens in the nasopharyngeal mucosa and allows your immune system to get on top of it before it becomes chronic. The tonsils, boy, are these nasty guys. As Dr. Issels found some 60 years ago, the tonsils, even when they appear normal on examination, are very often the source of focal infection. Almost close to 100% of the time, I can't give you the precise percentage, but close to 100% of the time, when you've had a root canal or other chronically infected tooth, within no more than a few months, much less a few years, the tonsil on that side that drains that side of the mouth becomes chronically infected, no matter how normal it appears. I have limited time to present all this, but I'll just say, and I can tell that story at some other time, I realized this on a personal basis and was starting to get a heart attack myself, chest pain. I'd done everything I knew how to do. I decided to lie to my ENT and say, these tonsils got to come out. I can't take it anymore. Tonsillitis is driving me crazy. Never had tonsillitis in my life. And of course, the surgeon loves to operate, so he said, sure. And he said, they look perfectly normal, but I'll take them out. And post-op, he comes around, he says, well, that was pretty interesting. I said, what's that? He said, well, when I grabbed the tonsil on the left side, which was the side where my root canal had been 10 years earlier, these tonsils don't heal, he said, pus started coming out. So after that, my CRP came down to normal. I stopped having chest pain, and I'm still here about 4 years later. This is what Dr. Issels found in the 1950s. He would treat metastatic cancer patients. He found 98% of his advanced cancer patients had between 2 and 10 dead teeth. Okay? And he also found that almost all of his tonsils in his cancer patients were chronically infected, even though they appeared morphologically normal. Okay? I'm not telling you to run out and do tonsillectomies, because one of the worst things you can do to an adult in terms of an ordeal. But we do have with ozone some emerging alternatives I'll mention. Now, and this is in particular, until I went to a conference with some ozone experts about a few months ago, I would have said there's no option other than tonsillectomy. If you still have an elevated CRP and you're having evidence of dealing with chronic inflammation in your body and you've run out of options to deal with it, and you know your tonsils are infected, well, you can make direct ozone injections into the tonsils. And these are amazingly effective at finally initiating a healing process. I say that because without help, once tonsils are infected, they appear completely incapable of resolving themselves. You need to give them some help. Now, one of the good points, too, of ascorbazone is, and you don't get this with ozone, and this is why the two together are especially good, is that dealing with chronic infections, you're also dealing with chronic sources of toxins. Now, the ozone is not really an antitoxin. The vitamin C is the prototypical antitoxin. So at the same time that you're killing pathogens, those pathogens are rupturing, releasing a lot of free iron, which is highly toxic, and I'll tell you at the end of the day how toxic iron is, and other pro-oxidant mechanisms from the debris in the blood. So having the availability of both ozone and vitamin C, you not only are killing and eradicating the infection, you're also mopping up at the same time and vastly decreasing the likelihood or possibility that your patient will have a toxin or Herxheimer-like reaction, which of course is very difficult to maintain patient compliance when they come into your office and they're feeling sick as hell by the end of the day. They're not going to be crazy about coming back. So, as most people in this room who treat patients and have clinical practices, I mean, things are rarely etched in stone. I will say the Ascorbazone Protocol is a work in progress. Ron and I are always talking, and we're thinking of other ways to tweak it. So far, clinically, it's doing very well on a wide variety of different types of patients, including Lyme, which we'll talk about in a moment. Now, like I said, we're tweaking it, so this is the basic overview. It's not etched in stone. Depending on patient body size, how sick they are, is going to depend a lot on dosage and how hard you hit somebody, or some people are very sensitive and you go much more easy. But day one, 15 grams of vitamin C with magnesium. And this incorporates the therapeutic infusion with the mop-up. Okay, let me re-talk about for a moment what the mop-up is. What causes a detox crisis or a Herxheimer reaction is pro-oxidants, toxins, circulating in your blood. And when you give a large dose of vitamin C very rapidly in many people, it will induce either killing a pathogen, which releases pro-oxidant substances, or it will reduce oxidized biomolecules inside the cell, and they'll start functioning normally and dumping out toxins. Either way, the high dose of vitamin C is causing a toxin dump into the blood. But what's the best way to deal with toxins in the blood? Vitamin C. It's all a matter of rate. So once someone's starting to get sick or not feeling well, you back off on the rate and the amount of vitamin C such that you're not getting a large amount inside the cells anymore or inside the pathogens. So you stop the acute detox, you stop the acute pathogen kill, but you still have enough vitamin C in the blood to meet those toxins head on and neutralize them. And this is exactly what happens. People that feel lousy suddenly start feeling good. So now we add to this not only the ozone, but also Ron's been talking about the ultraviolet blood irradiation. So it really is, ultraviolet blood irradiation, in my opinion, is a different way of doing the same thing that you do with ozone, just by a different mechanism, okay? Day two, you just increase the dose of vitamin C and increase the dose of magnesium. And then finally try to work your way up to 50 grams of vitamin C. Obviously, if you have a 200-pound man, you might want to push it on up to 100. If you're giving a 120-pound woman 50, okay? So you still need a certain amount to get above in order to get the saturation effect that we're looking for with the vitamin C. Now, the oral part of the Ascorbazone Protocol is again just designed by different routes to get the effect of the vitamin C saturation as high as possible. So the liposome encapsulated vitamin C, this not only goes directly into cells, intracellular, it also radically increases the amount of vitamin C in the immunoactive cells. Okay, monocytes, which are the first thing to come to a site of inflammation, are also the cells in the body that have the highest concentration of vitamin C. And when you can get that concentration of vitamin C even higher in those cells, as with liposome encapsulated vitamin C, which delivers it through the cell wall, then you can get, at the same time you're getting large amounts of C in the fluids, you're getting immune cells that have been supercharged with vitamin C. We also add liposome encapsulated glutathione for the same reasons. Sodium ascorbate powder. It's always good to push sodium ascorbate powder independent of everything else you're doing to the point of bowel tolerance, because you're not only getting an additional source of vitamin C into the system through the immune cells that surround the gut, but you're also directly neutralizing the food rotting pathogens and toxins that are generated on a daily basis. Because I've got news for you, nobody's got perfect digestion. Some are a heck of a lot better than others, but everybody's generating a certain amount of highly potent gut-related toxins on a daily basis, especially with the type of food combinations that nearly everybody eats. Ascorbyl palmitate, I might add, see, this is the multi-C protocol. Liposome encapsulated C, sodium ascorbate powder in the gut, ascorbyl palmitate, which is a fat-soluble form of vitamin C and allows you to get a lot of vitamin C into the cell membrane structures, which are fatty in nature, and then the intravenous vitamin C. So you add ascorbyl palmitate, magnesium, a good source of vitamin K, a regular source of vitamin D, zinc. Zinc is a very strong contributor to dealing with infections, and just about anything else you want to put in as a clinician. Now, I mentioned the hormone balance. I mentioned already the extremely, amazingly to me, but extremely critical role that normal thyroid function can play in allowing your body to keep infections from setting up shop focally. And of course, here I'm talking about the coronary artery, but although we don't have the same evidence for this as we do for the coronary artery, because that's very well established now, I believe strongly the same thing applies for keeping the focal infection in root canals and other infected teeth from setting up shop inside the breast and resulting in breast cancer. Because I guarantee you, most breast cancer cases start with an infection in the mouth, period. So, you want to get the hormones adjusted. Now, this is something where, of course, the adjustment of the hormone is going to take a longer period of time. So somebody might come in, depending on what their condition is, and you're hitting the Ascorbazone Protocol. You're not going to have the hormones adjusted in a 2-week period, obviously. So, but still, for the long-term maintenance of that success, it's very important to adjust hormones correctly. And the main tenets of such hormone treatment are low, slow, as bioidentical as possible, and just as importantly, especially in older individuals, you don't shoot for more, and this is, we're talking mainly estrogen and testosterone here, you're shooting for low normal. Don't shoot for high normal. That's like putting jet fuel in a Model T. Okay, your 80-year-old patients aren't going to appreciate the same amount of testosterone that the 40-year-old might. And that's the goal you shoot for. Now, let's see. This was the email I received some 3 years ago that first gave me the information that got me to start thinking about vitamin C and Lyme. This particular individual, I had given a presentation. It was in Tennessee some months earlier, and I really don't remember exactly what I said. But apparently, because they had lay folks there as well as the physicians, apparently I said, and it sounds familiar, if you want vitamin C to work, you just got to keep taking it, and you got to take a lot of it. Okay? Well, I didn't know who I was preaching to. So this nurse reported back to me that this lady that had advanced Lyme disease for many years, absolutely miserable, had taken everything she knew how to take, and so she got the idea that, I should take a lot of vitamin C. So she came in and was able to convince the nurse and the doctor to give her, after working her dose up, 100-gram infusions. And she's a fairly small lady. And she came back every day for a 100-gram infusion. When they were open, I guess it was 5 or 6 days a week. Well, by the 20th day, she hadn't gotten better at all. She felt just as bad as she always had. And this is the part that amazes me. So I don't know if it's because of what I said or emphasized, but I said, you got to continue. She decided she was just going to continue. And of course, the doctor and the nurse are feeling bad because they see somebody depleting their financial resources and they're not really getting better. It sort of makes you feel funny about whether or not you want to continue the treatment. But anyway, they continued it, and on the day 23, the lady came in and she felt normal. She said it was like, the nurse said it was like a light had switched. She went from 0 improvement for 3 weeks to feeling perfectly normal overnight. And then, very intelligently, the lady insisted on getting 100 grams of vitamin C a day for another week to make sure there was no relapse. And she didn't, and she's fine today. I happened to mention this to another physician in one of my presentations, and he had a large pool of Lyme patients. And he basically did the same thing with 15 more chronic Lyme patients. And amazingly enough, in a very, very, very similar time frame of virtually no improvement and then dramatic, complete improvement, quote unquote, overnight after about the 3rd week of infusions. So this certainly strongly suggested that even though we might not know the mechanism, vitamin C was going to do the job if we gave enough of it for a long enough period of time. And so Ron and I did a bunch of conversations and thinking and knocking around ideas. And this is how we started to come to the Ascorbazone Protocol, because we wanted to hit it with this vitamin C as many different forms as possible, while at the same time giving the support of something that's even arguably more effective than vitamin C on a chronic infection, for all the reasons I mentioned. And that was the rationale. So, some of the considerations about Lyme that make it a unique infectious challenge. A lot of these cases, especially the ones that have been present for years, we're talking about redox balance earlier, Ron was talking about. These patients have many, many biomolecules oxidized in their body. They have a huge oxidative burden. and you're not going to do anything that's going to reverse that overnight. So not only do you have to kill the pathogen ultimately, or stimulate the immune system to kill the pathogen, you have to start reducing the oxidized biomolecules, and that's not going to be done quickly. Furthermore, Lyme itself produces more pro-inflammatory cytokines, so this continues the oxygen consumption. Now, the Lyme pathogen, Borrelia burgdorferi, it also likes to hide. Okay, you know, if you have a pathogen that's circulating in the blood, or it's in the extracellular spaces, or it's even in the cytoplasm, that's very accessible. When it starts accumulating inside immune cells like macrophages, it's not so accessible. Lyme also forms cyst-like forms that are very resistant to therapy. And it also forms biofilms, okay? Now, all pathogens, except Lyme, all pathogens utilize iron to proliferate. They concentrate iron, okay? When you take iron away from them, they start to die, like with iron chelators. So pathogens proliferate on iron, except Lyme. Lyme proliferates on manganese. So one of the ways, a primary way that not only vitamin C works with pathogens and cancer cells, which also concentrate iron, very similar to pathogens, the vitamin C, via the Fenton reaction, goes into the cell, high levels of iron, converts Fe3 plus to Fe2 plus. Fe2 plus gives the electron to hydrogen peroxide. Hydrogen peroxide is then broken down into hydroxyl radical, which is the most oxidizing toxic substance on the planet. It can't migrate because it immediately oxidizes whatever it's next to after it's formed. Anyway, that's how you upregulate intracellular oxidative stress and kill the pathogen or kill the cancer cell. Well, what if there's manganese there rather than iron? Does it work the same? Now, just the opposite, it looks like manganese might actually have an antioxidant effect inside the Lyme organism. Also, now with those thoughts about iron that I just mentioned in mind, the three main Lyme treatment antibiotics, doxycycline, tetracycline, and erythromycin, exert at least some of their antipathogen effects by chelating iron. As I mentioned, with regular pathogens other than Lyme, if you take away or limit the amount of iron available to them, they stop proliferating. And if they stop proliferating for a long enough period of time, the immune system kicks in and does the rest of the job and eradicates the infection. So, the three main antibiotics that they're using for Lyme are iron chelators. That's not going to have much of an effect on Lyme, at least with regard to this one mechanism. The Lyme biofilm is susceptible to the ozonides. Generally, early treatment for Lyme is highly effective, especially when you add vitamin C to your antibiotics, etc. And this is because much of it is still circulating in the blood, it's in the extracellular fluid, and it's not yet colonizing in high degrees in areas of the body where you don't have good access. Another reason why Lyme patients are slow to respond or sometimes don't respond at all has to do with what's called the post-Lyme disease syndrome, which is seen with the most advanced cases of chronic Lyme. Consider this, when you've had an infection for a long period of time, what's happening on a daily basis, every second, every minute of the day? It's continuing to proliferate, it's continuing to increase the oxidative side of your redox balance, okay? Whenever oxidation starts to predominate, you're sick. There's no way around it, okay? Whenever reduction starts to predominate, you're well, okay? And the more you can shift that, the better. So, in addition to needing a protocol that can eradicate a pathogen such as Lyme, or at least hold it in check while it stimulates the immune system, you also need something that's going to actively restore the reduction side of the redox balance, and that's what the vitamin C does. Laboratory testing with Lyme, this is another advantage of the Ascorbazone Protocol because it's very difficult to pin down Lyme in laboratory tests, okay? But you know when the patient is better, okay? So with laboratory testing with Lyme, they have PCR testing. They can definitely detect the organism, but you also have antibody effect. So you could knock out the Lyme pathogen and still have persistent antibodies. That's just the vaccination phenomenon. You stimulate an immune response, and the immune response persists, and you don't really know whether the pathogen is gone or not. But sometimes, as with many Lyme patients who have Lyme arthritis, you can take synovial fluid specimens, detect the pathogen by PCR testing, highly sensitive, and then document, to go along, obviously, with clinical improvement, that down the road, there's no more PCR detectable Lyme in the joints. Okay. Now, we've had many cases of different types that show good response to this at the clinic. One of the most profound responses, and I want to go over this in a little detail with you, and it's also reported in one of the Riordan Clinic newsletters, and that's what that reference takes you to, that link takes you to. What's amazing about this particular individual is she'd been diagnosed with chronic Lyme. She'd been more to 10 doctors in 5 states over a 4-year period. She was extremely intelligent, very aware of her clinical symptoms and how she felt. And when you read this newsletter, she's a very talented writer in explaining how she feels. In her words, early on, she would, associated with a Lyme, sometimes have a seizure, chronic unbearable pain, electric shock sensations in her brain, severe anxiety and panic attacks, memory problems, thinking problems, nerve damage, terrible insomnia. In her words, she described her days as a monumental struggle to endure. Ironically enough, she had such an advanced case of Lyme that her biggest fear was effective treatment because she had already suffered so much from acute detox reactions. And that's why I mention again, this is one unique aspect of the Ascorbazone Protocol, is because it could give you protection against the detox, okay? You don't want to burn down the house to get rid of the roaches, okay? You need to keep the basic structure intact, and you need to keep the patient feeling well while you effectively treat them. Well, in this case, she got no Herxheimer reactions at all. In only 6 days, she actually had a difficult time moving around or walking. She went from sitting in a chair for 4 straight months to literally, in her words, moving all day. And she was blown away. And she's maintained that improvement. So it would appear, even though, like I say, it's very difficult with current Lyme testing methodology to know for sure it's completely gone, you still can't do much better than clinical normalcy, especially clinical normalcy that maintains. Now, the glutathione part of the protocol, address that for a moment. Vitamin C, in general, is what you would consider your most important, both functionally and concentration-wise, antioxidant in the extracellular spaces, in the blood and extracellularly. Glutathione, most importantly and in highest concentration, is your most important antioxidant inside the cells. And vitamin C and glutathione have an intimate interrelationship where whenever there's an increased percentage of the oxidized species of one, the other can regenerate the other, so that they can always make sure that the electrons are in the right place where they need to be. So glutathione, especially when it's given by liposome encapsulation, you get a good intracellular delivery. You can be supporting the detox mechanisms at the same time you're treating the pathogen. Now, I want to touch upon and expand upon a few of the things that Ron mentioned earlier, and maybe put an exclamation point on them. Not only do most chronic degenerative diseases have an infectious or toxic component, I'm going to tell you well over 90% do. Okay? All chronic degenerative diseases have something that are continuing to stimulate them. They're continuing to put oxidative stress in. Otherwise, antioxidant measures would allow it to resolve. It would start to reduce oxidized biomolecules, and things would start to resolve. That's not the case. For example, rheumatoid arthritis. I can tell you right now, that's a 100% focal infection disease. Nobody has rheumatoid arthritis that doesn't have a chronic streptococcal infection somewhere in their oral cavity. Usually they're tonsils, okay? It's amazing how some of these subspecialties in medicine can exist isolated inside their little cocoon and not realize that at least their particular illness is readily explainable and readily resolvable. Now, I say resolvable, I mean advanced rheumatoid arthritis. You're not going to resolve that because there's secondary physical changes and deformations and everything like that. But in 1950, in the New England Journal of Medicine, of all places, they showed that vitamin C was able to cure 8 children with acute rheumatic fever. Completely cure. Yet, even after you read the article, then you read what the authors conclude, and the authors conclude it appears vitamin C has some anti-rheumatic activity, and this needs to be investigated further. But you read their own words, and each of the cases were cured. So this is part of the, I don't know, we sometimes not only have the veil pulled over our eyes, we pull it over our eyes ourselves. So, where are most of these chronic focal infections I'm talking about? And some of you that like to study the history of medicine, you might recognize the term focal infection, and they've had a lot of wars on this over the last 100 years, okay? And then ultimately they try to just call it a focal infection hysteria, and you just want to pull teeth out all the time, blah, blah, blah. I will tell you, chronically infected tooth roots, in either a root canal treated tooth or what I'm going to talk about tomorrow, a asymptomatic chronically infected tooth, cavitations to tooth extracted sites, infected implants, tonsils are the real mean one because they look normal and they're very infected, and sinuses. These cause 90% of disease. Now, they're the most common non-oral cavity site that are going to cause about the other 10% of disease problems because they continue to feed the oxidative stress. All diseases are oxidative stress, literally, not figuratively. There is no other pathology. At the cellular and molecular level, there is no other pathology other than the fact that enough biomolecules have been oxidized. That's it, oxidized. That's what toxins do, they oxidize. The non-oral cavity sites include the bronchi, the gut, like the appendix, like diverticuli, gallbladder, liver, a lot of in the ladies' fallopian tubes, uterus, a lot of chronic prostatitis, some heart, a lot of chronic urinary infections, and then even in the joints and the bones. So, getting back to ascorbazone then, what I would submit to you is, based on what we now know about the pathophysiology of all chronic degenerative disease, the more you can put an antioxidant effect into the cells while limiting or eliminating the oxidative effect of ongoing infections, both sides of the balance. So knock down the ongoing oxidation, increase the antioxidation. Even if you don't get a clinical cure, you are going to improve dramatically the clinical condition of just about every patient that you have, okay? And because of its effects, at the same time, it supports antioxidant capacity while nuking pathogens. The Ascorbazone Protocol is ideal for this. So, a brief recap. Number one, many chronic degenerative diseases, like I said, greater than 90%, have significant underlying infectious components. Number two, all chronic infections and diseases, because of the fact that the disease is there and the infection is there, are accompanied by subclinical scurvy unless extremely vigorous supplementation is being undertaken. Both vitamin C, number 3, and ozone are excellent standalone therapies for all infections as well as chronic degenerative diseases and cancer. I mean, for those of you who treat a fair amount of cancer, whatever else you do, and I'm not saying there aren't other effective ways to approach cancer, there are. But when you consider the impact and the price, no cancer patient should be deprived of high-dose vitamin C and ozone therapy. Okay, it's pardon me for being judgmental, but after you see this information, I would submit to you it's malpracticable not to include this always in the treatment of your cancer patients, regardless of what else you use. Then number 4, ascorbazone is a protocol that allows you to get a synergistic effect of these two. And then finally, as I said, considering the fact that it's completely non-toxic, highly economical compared to most of the other things that we do, it's a good thing to use routinely in just about any condition, because all these conditions, as I said, have increased oxidative stress and have an undiagnosed focal infection that needs to be addressed and eradicated. And now I'm going to show you a little video to introduce what I'm going to be addressing at 5 o'clock today, which I think it'll shock everybody. I don't think anybody will be out of this room not shocked. And once you contemplate the nature of the information I'm going to present to you, you're going to see that this is a final common denominator, and a final common denominator aggravating factor for 100% of chronic degenerative disease. And it's going to tell you that it's the primary reason for gluten sensitivity and celiac disease, amongst other things. I just mentioned that because gluten sensitivity is such a popular topic these days, but there's a reason why we suddenly start developing gluten allergies. Hello, I'm Dr. Levy. We have a video clip that's going to follow that's going to demonstrate very dramatically that some of the nutrients and additives that go in enriched foods might not be everything you think that they are. If you did not reach this video clip by seeing issue number 4 of Health eBites, you might want to check out that issue as well, and will help explain what you're going to see. We're going to look at an enriched cereal that says it has 100% of the daily requirements of vitamins and minerals and demonstrate through magnetism that the form of iron inside this cereal is actually metallic filings. It should be clear then that this is not really a bioavailable form of iron, and in fact may well represent a toxic form of iron. Extrapolate this to all the other enriched foods, and then you can see that you might be getting a number of, quote, nutrients, unquote, that you might not want to take in on a daily basis. Okay, we have here a box of cereal that supposedly has 100% of the minimum daily requirements of vitamins and minerals, including, of course, iron. So let's go ahead and open it up. We have our flakes. Let's see. Okay. Now we're going to take a few flakes out. Put them on top of the water, and we'll be able to show with this strong magnet that there's enough metallic iron in here to steer this flake around the water. And if you think this isn't unusual, take a magnet and float anything else on water. The magnet will have no effect on it. Okay, having done that, we're going to go ahead and take this bowl of water, put it out of the way. Our next step, I'm now going to show you a demonstration in which we're actually going to pull these metallic iron filings out of the cereal, and you'll be able to see them very dramatically. We have a baggie here, regular ordinary baggie, and we have taped to the side of the baggie another one of these magnets, just like this one here, so that when we put together corn flakes and water and they're all mixed and crunched up together and we slosh it all around, you will eventually see black iron filings collect on top of this magnet. What we'll do first is we'll put the corn flakes or the wheat flakes, as the case may be, in the mixer with water and puree it fine so that all the iron filings that are contained in there can be easily pulled out of the solution by the magnet. Take the box out the way. We'll try to use most of the flakes so that we can get a maximum concentration of iron for you to see, although you'll be able to see them on just half the bag. Okay, we're now going to transfer this cereal dissolved in the water into the bag. We might put a little bit more water in to make it a little more fluid. And then we're going to slosh it around so that as much of the volume of this passes across the top of this magnet, and you'll see that these iron metallic filings will then gather. Try to be delicate and not too messy. Okay, we slosh this around. Our magnet is right here. It's the same as this magnet. We see this green. Here's the green side of this magnet, and you see this enormous amount of metallic filings here. After this, I'm going to cut this out of the bag, and you'll be able to see these filings in even greater detail after I dry them. All right, now we're going to take an empty bowl and put this in here so that we don't make an enormous mess when I just take my scissors and cut this area out so we can look at these iron filings in a little greater detail. Okay, now I'm going to put a little water on this. Now the next thing I'm going to do is I'm going to take a hair dryer and dry these out completely, and then pull the magnet off and drop them on a sheet of paper so we can see them in the final detail. Okay. Take the magnet away. Okay, now we have the filings on the paper. I'm going to take a magnet underneath the table and see how the filings stand up. We push them over from one side to the other. These are clearly metallic filings attracted by magnetism. By deduction, they're iron. So that concludes our demonstration. I think you'll agree this is a pretty dramatic demonstration that you can pull, with magnetism, metallic iron filings out of supposedly enriched cereal. Are metallic iron filings something you want to eat, either in cereal or in pastas or in other flours or other enriched foods? I don't think so. So, buyer beware. Or maybe buyer be aware. Bon appetit. So, think about that at lunch today, and we'll talk again this afternoon.
If there's any questions for Dr. Levy, we could answer a few questions if you want to pass them to the center or ask. Yeah.
Your patient, MB, needed 23 treatments before she felt better, just taking high-dose vitamin C. Can you tell us how, what the time difference or number of treatments with ascorbazone, is that shorter?
Yes. This lady was getting her dramatic effects within a few days, and it was just continued for 2 weeks to assure an optimal result. But no, that was a good, if you will, direct empirical evidence that the protocol was able to accelerate the whole process by virtue of the synergy between the different modalities. Is it helpful clinically to measure iron levels in patients who are chronically sick? Absolutely. I'll talk a whole lot more about iron toxicity this afternoon, but iron toxicity plays a huge role in how well you respond from any condition. Should we continue IVC even after patients feel better post-Lyme disease treatment? Well, treating any infection, you should always use the therapeutic high doses of vitamin C for at least several days, preferably a week, after you've already gotten to what you consider to be your optimal clinical outcome, okay? Patients relapse very easily when you stop vitamin C quickly after you start getting your positive clinical response. So yes, continue. And this is also where liposome encapsulated vitamin C comes into play very well too. For most patients, that are getting economically strapped, and they would be best off if they took 100 grams a day IV for the next week. You can just about always get away with giving them 10, 15, 20 grams of liposome encapsulated vitamin C a day as a maintenance and finishing therapy as well. Compare IVC to lipovitamin C dosage. it is a little bit apples and oranges, so you have to have a clinical effect. There are some things where lipo-C taken orally is actually better than intravenous C, and there are some situations where intravenous C is clearly better than oral liposome encapsulated vitamin C. The liposomes, even though they're taken orally, are very effective at getting their payload inside the cell without the consumption of energy. Even when you take vitamin C intravenously, because it's unencapsulated, not in liposomes, you need to consume energy to get it inside the cell, sort of robbing Peter to pay Paul. But if your infectious presence is largely in the blood and in the extracellular fluid, the IVC is going to be superior. If your infectious and toxic impact is already concentrating and getting deeply into the cells, the liposome encapsulated vitamin C is going to be the preferred modality, although when it's possible, you want to use both. DMSO is very effective at getting things certainly through the skin, and I have to say I believe it would also help get it into the cell, but I can't tell you that definitively. I do know empirically that in cancer patients and other conditions, DMSO is enormously effective and an incredibly good adjunct to whatever other methodologies you're using. The only downside is, your patient's going to smell like rotten eggs for a few days after the IV is completed, and they need to understand that and just become hermits for a few days, but very, very highly effective. So I've got nothing but good things to say about DMSO. What do you do for patients where tonsils are already removed? Well, I consider them to be lucky. But effectively, it just means you've eliminated one major source of focal infection that you need to look for. That said, if the patient had the tonsillectomy done many years ago, 50, 60 years ago, they weren't as effective at a complete removal of the tonsils like they are today. So you could have tonsillar tags or other tissue that remains, and the best way is just to make sure with an ENT doc that there's certainly no physical or evidence that any tonsil tissue has been left. But basically, if your tonsils are gone, I consider you blessed.
Contraindications to vitamin C.
Can you discuss contraindications and side effects for vitamin C, ozone therapy, and glutathione? Well, the worst contraindication, well, no, there isn't a contraindication. Vitamin C, main contraindications are impaired renal function, okay? Pre-existing impaired renal function, okay? Vitamin C is a source of oxalate, and there's many other sources of oxalate, so that if you're prone to form stones, vitamin C and many other things can promote that stone formation. However, vitamin C is so anti-stone forming that in patients with normal renal function, not only is there no increased incidence of stone formation in these people, vitamin C will actively help dissolve pre-existing stones. One of the reasons of which is to start forming a stone inside the kidney, what do you need? You need a foci of oxidative stress. What eliminates oxidative stress? Vitamin C. So remember, in chronic renal failure patients, everything's toxic, vitamin C included. So that's not to say you can't use it in patients like that. You just have to be very careful. When they're chronic renal insufficiency, in other words, they still put out some urine, but their creatinine is elevated, you can oftentimes, under a monitored circumstance, give a fairly sizable amount of vitamin C as long as you maintain a high, brisk urine flow with Lasix or furosemide or something along those lines. Oh, and ozone therapy, glutathione. Ozone therapy has been used in Germany for a century, and there's virtually no significant side effects. I mean, every now and then you might run into someone that has a sensitivity. You can do a detox reaction, but in and of itself, a properly applied ozone application is as close to harmless as you could get. Same thing with glutathione. Glutathione, again, can cause a detox reaction, but other than that, it's just about harmless. What is the difference between using ozone and using hyperbaric oxygen therapy in tandem with IVC? Not much. We did this for a long time, too. We gave vitamin C through a special portal into the hyperbaric oxygen tank while they were getting a treatment. Highly, highly effective for infectious and other conditions. I will tell you, it's my opinion, I can't cite you evidence on this, but it's my opinion that ozone, intravenous hydrogen peroxide, hyperbaric oxygen therapy, ultraviolet blood irradiation, I think they all do the same thing. And they all have similar mechanisms. Okay, so it's, now, you know, there might be subtle differences. One might form more of one species than another when it reacts, but they basically deliver a pro-oxidant form of oxygen. Okay, all right. If a patient with Lyme disease is taking corticosteroids or other medications, did they have to stop them to start IVC high-dose treatment, or can the patient be treated with the same with both? The same. No, there's no need to make any significant alter. The only thing that vitamin C does on concomitant therapies is, if that concomitant therapy is itself pro-oxidant in nature, like a chemotherapeutic agent, vitamin C, if it meets that therapy in the blood, it can neutralize it, okay? Like it would neutralize any toxin. However, for example, the oncologists have sort of seized upon this to now start saying never take vitamin C in chemotherapy together. Well, that's completely wrong too, because we have many studies now that show as long as you take them, stagger them, not only does the vitamin C not nuke the chemotherapy, it augments the chemotherapy effect.
We have time for one more.
All right.
This patient did actually have a...
Patients have had increase in shingles and herpes with IV glutathione. What would cause this? Well, with herpetic lesions, you have storage sites where you have active herpes virus, okay? And if you get an effective treatment of that, it doesn't nuke all of it at once. It causes a release of that into the lymphatics and can, in fact, result in a flare. But I would consider this to be a sign that if you continued the therapy, you're well on your way toward resolving it. I've had a couple patients who have had the recurrent fever blister problems, okay? And so they wanted to try IV vitamin C. And both of these patients, after their first IV vitamin C, it's a good thing they didn't call me at night. They'd have scared the hell out of me. But fortunately, I just get to talk to them the next day after everything's happened. And both of them got horrible pain in their breasts. Okay? What are they doing? They're nuking the herpes virus in the lip, draining the pro-oxidant products, including a lot of free iron, into the lymphatics of the breast, okay? And the breasts just felt like they were on fire. And then we just continued the vitamin C, and they had the reaction every day for about the first 3 days, less and less and less, and then no more reaction.
This will be the last one. Then
All right.
We'll get the rest of them later.
What does magnesium chloride do in the Ascorbazone Protocol? Well, it makes you live longer. Actually, magnesium chloride decreases all-cause mortality. And when you take enough of it, it can decrease all-cause mortality in a couple of studies for at least 5 years after a one-time infusion. Now, chemically, magnesium is a natural calcium antagonist. And in my presentation on death by calcium, you'll see that calcium is one of the primary ways by which cells are made sick and cells are caused to die, okay? When you take a lot of magnesium, you lower calcium levels inside the cell, you decrease the oxidative stress inside the cell, and you also dissolve pre-existing calcifications, okay? So, lots of good stuff.
Okay, I think that's...